Over the years, the concerted effort to tackle the menace of the human immunodeficiency virus HIV has seen tremendous progress. The need for a collation of data from around the country through the years of patients who have been registered and have undergone treatment was seen, and the National Data Repository is the response to that need.
The National Data Repository, NDR, is envisioned to be a repository for health data regarding all diseases of public health importance across the country. We are starting with HIV data, where there seems to be a lot of data in an electronic format that can easily be integrated into a repository. But in the future, we do hope that other diseases like polio, malaria, tuberculosis, and even maternal and child health issues will have their data integrated in the repository.
In the fight back against the scourge, the collation of data has been of great help to the cause. Tracking people living with HIV has become easier, enabling healthcare workers to keep an eye on the progress of their treatment. A competent organization was required to take on the task of creating a repository, and Caritas Nigeria, the professional agency of the Catholic Bishops' Conference of Nigeria (CBCN) for Relief and Development, was saddled with the responsibility of implementing the Data Repository project in Nigeria.
The government of Nigeria, with its international development partners, are the ones who originally conceived the idea of having a national data repository. The implementation is via a contract with a US-based development organization, Inductive Health Informatics. So Caritas Nigeria is essentially responsible for overall project management and ensuring that the quality of what is being developed for the country meets the expectation of all stakeholders, especially the government of Nigeria.
Through rigorous, relentless trainings, Caritas Nigeria has been able to teach and guide a sizable number of team members of its HIV/AIDS care, treatment and support program, known as Sustain Nigeria, to properly gather and store data which is included in the repository.
Documentation. You know, we Nigerians are not good at documenting things. Now we have learned not just to document HIV/AIDS activities or sustain project activities, but also document things that are for our own good as a hospital, like report writing and all that. And it has helped. As an administrator, I find that very, very helpful.
Caritas Nigeria in this project are playing two key roles: the overall leadership and managing of the funds, and ensuring that the deliverables expected per time are achieved when expected. But also important is that we are providing guidance in terms of the expertise with the local situation in the country, and making sure that what is being developed is not just useful, but it is implementable and will not be one of those failed projects that you start and end up not using.
The Strategic Information Unit of Caritas Nigeria is responsible for monitoring and evaluating quality improvement and data demand information. For easy retrieval, irrespective of time and place, all forms of data have been converted to electronic formats and stored on portals.
In Nigeria and most of the countries in the third world, a lot of things are paper-based. And when you are dealing with large volumes of data, it's not easy to aggregate numbers or retrieve certain information that would have an impact on the direction of your program. And it's important for a program to have data at her fingertips, so that key decisions can be carried out quickly, gaps identified and all that. So for us, we realized that going the paper-based way would limit us in our response.
The volume of data generated from several facilities across the country under the Sustain project led to the need for the creation of an efficient system of gathering an electronic medical record database for easy access and retrieval when necessary. Thus, reliance on paper is becoming less, and with time, non-existent.
Having electronic medical systems gives you the advantage of quick retrieval of data, and it is better managed when you have clients' data in a database that you can update as you provide services. We have ensured that the EMR rollout is part of our activation package. So whenever we go out to activate any new site, we ensure that those sites also have the EMRs as part of the startup plans. And of course, in the process, we build capacity of staff to manage those EMRs very well.
One of our facilities, SON Jikoi, won a national award following the implementation of this National Improvement Activity Nigerian Call. They were able to put in a lot of work where patients' care is given great attention, documentation is great, and they were able to come up with a very good improvement plan to improve on EID, that is early infant diagnosis for babies that are born to pregnant women who are HIV positive. They try to see how they can improve the EID sample collection and results coming back for patients to be able to know if the babies are positive or not.
The transmission of HIV from a mother to her infant is a worrisome occurrence that undermines the efforts being made to halt the spread of the infection. Caritas Nigeria has created an intervention, a tracking system to plug the numerous gaps hampering the effort of reducing and eliminating further transmission from mothers to children.
The transmission of HIV from mother to child transmission rate has remained high despite all efforts over the years to curb this challenge. So the need for enhanced monitoring more closely of the entire PMTCT cascade was recognized by the government of Nigeria and stakeholders, its development partners. And so with funding from PEPFAR through CDC, Caritas Nigeria is implementing the Option B+ tracking system for collecting data relating to PMTCT services across the country via mobile devices empowered with a mobile application.
The prevention of mother-to-child transmission of HIV is a vital aspect of battling the spread of HIV in the world. The SUSTAIN project has deployed the necessary requirements, be it material or human, to ensure 0% occurrence in the country.
The goal of PMTCT is to prevent or at least minimize vertical transmission of HIV, which means prevention of transmission from mother to her unborn child. It has been challenging reaching pregnant women in various places where they are, both in the facilities and in the communities. We have been able to enable over 1 million women know their HIV status, and amongst them, all the women that are positive have been linked to HIV care and treatment, and their exposed infants enabled to access early infant diagnosis.
It's always a great joy to have positive parents having babies that are HIV negative. It gives great joy to the family and to those of us who are caregivers, because when that happens, I'm always happy. And the good news is that of all the women who were tested HIV positive and went through the facility for antenatal care, no baby tested HIV positive.
Sewese is a beneficiary of the PMTCT program. Her adherence to the directives of the medical staff has helped us save the life of her child and hopefully the ones yet unborn.
I was sick and started getting leaner. I went to almost every hospital around, but I did not know what was wrong with me. After several attempts, somebody brought me here. I was tested and discovered to be reactive. But before then, my first pregnancy, I gave birth to a child who died. Subsequent pregnancies, I take in and abort again and again until I was discovered to be positive. After treatment commenced here, I had a child who is still alive.
Counseling infected mothers is very crucial. It prepares them for the responsibility involved in preventing transmission of the infection from mother to child, as well as live healthy lives and maintain a good relationship with their spouses.
Counseling is really, really important. So when we bring women together, you counsel them individually because they have different differences. That's how they will open up to you, and you will be able to note the challenges that they might encounter.
Since I came on board from August 2014 to December 2016, we have had up to more than 500 children that were delivered under me in this facility, and they are coming now without HIV.
In keeping with its status as a charity foundation and with funding from the Center for Disease Control and Prevention, CDC, Caritas Nigeria has made PMTCT services free for patients to improve health outcomes for mother and child.
We have come to form a very strong bond with our PMTCT mothers. They extent that right from when they are tested positive and they are enrolled into the PMTCT program, they tend to come regularly because most of the services for our PMTCT patients are free.
CCFN really helped. And what they were doing that really encouraged women to come here is, normal delivery here is 4,500. But when you are a PMTCT mother, it is just 1.
When they commenced me on the drugs, within a short time, I took in, and I was advised to come for antenatal care. And I came, and they told me what to do until delivery. 6 weeks after delivery, they took the baby's sample, then commenced the baby on Septrin, and the baby came out negative. At the age of 18 months, the baby came again for the final test, and the baby came out negative.
They take me, they do sample for a year because of people who don't want to take their drugs normal. I even they advise people here, say it's good. So they take your drugs normal time and do viral load, that they advise people here because I'm happy.
Unborn and nursing babies are more prone to contracting HIV and AIDS. Working hand in hand with faith-based organizations, especially the church, the Baby Shower Project has been given to the people who have gladly received the service.
We collaborated with Healthy Beginning Initiative, and we came up with the baby shower integration into PMTCT. What do we do under Baby Shower Projects? Under Baby Shower Projects, all the pregnant women within the churches are brought together. The husbands are provided with gifts to present to their wives and appreciate them for carrying the pregnancy for them. And then we in Sustain also provide them with HIV testing services. Now with this initiative, we've been able to provide HIV testing services to over 10,000 women in the community. And we've also achieved 50% male involvement by testing their partners also within the lifespan of this project.
The reach of the Baby Shower Initiative is commendable, as a sizable number of women have benefited from it. In Logo local government area of Benue State, the numbers tell an encouraging story of progress.
We have tested 1,740 participants. Men tested are over 516, and women are about 1,125 women tested. 108 reactive cases thereabout. We have 74 of them assessing care. So Baby Shower offers them what ordinarily they will be reluctant to go for.
The Baby Shower program offered us an opportunity to get tested and health information for free. We also got gifts, and our pregnancies were celebrated as well. My husband and I are finding things really difficult at home. The baby shower came just at the right time to save our faces, despite the challenging financial situation at home. We got gifts that reduced the cost of medical services a pregnant woman would normally receive at the hospital.
Caritas Nigeria's aim is to relieve people of their suffering, and thankfully, its impact is being felt. The Sustain project would not have been the resounding success that it was without the selflessness and sacrifice of the staff at Caritas Nigeria, who go the extra mile to create a harmonious environment where everyone truly enjoys the fullness of life.
I didn't know I would have a baby because of the past experience I had. But now I am happy because I followed what I was told to do. I have a baby now, and I am even pregnant as we speak. And I am sure that this baby in my womb will come out fine. I am very happy and grateful. I have nothing to offer this group that has brought us this support, but I pray that God will reward them.
The Catholic Bishops' Conference of Nigeria, CBCN, deeply appreciates the support of the United States government that funded the Sustain project through the President's Emergency Plan for AIDS Relief PEPFAR and the Center for Disease Control and Prevention, CDC. Thank you for helping us bring succor to our brothers and sisters in need.
No so long time ago, there was a small town that harvested food where they received a meal. After being sure that people get what they need, they gather happy and joyful and humble in their acts, which is the sign of the presence of our living God. I'm done with this world.